My practice will focus on taking care of chronic diseases like diabetes, hypertension, hyperlipidemia.
So I've been in pediatrics for 19 years now, and I love, of course, taking care of the little ones and the babies.
Normally, I would come to clinic and I would see patients all day long, and they were long days, but we were seeing a lot of patients in clinic.
I never thought of my job as a high-risk job until recently I was with a patient suspected of having COVID-19. I recognized that this is a different kind of practice than I ever thought I will ever do.
Now I get up, I put on scrubs so that I can protect my family. I wear protective gear all day long.
I think that one of the most important things that I'm seeing in my clinics right now is that I have a lot of babies who are tiny little babies and toddlers who need protection against vaccine-preventable disease. And they feel too scared to go out of their house, even to go to the doctor.
We had to reinvent the way we see patients. We're trying to minimize the exposure of our patients to the virus within our clinics. I went from 0 telemedicine to 70% telemedicine.
I'm amazed at how much I can do on a video visit. If you had told me a few weeks ago that I could do a complete diabetic check with having a patient do their blood pressure at home and their blood sugar, and just looking at them and talking to them and feeling confident that we're treating their chronic diseases appropriately.
But often certain things will still require hands-on assessment.
We have a protocol to separate those who are having COVID-like symptoms from those who do not have COVID-like symptoms to make sure that our healthy patients are protected.
During the 1918 Spanish flu pandemic, a lot of people died from chronic preventable causes of chronic diseases, but they just basically were staying at home, avoiding seeking health care, afraid of being exposed to the Spanish flu. And we're doing everything humanly possible to minimize the exposure of these valued patients to the virus during their visit with us here at the clinic.
You know, we're just going to keep taking care of patients. I mean, this is the deal. This is our time to take care of patients, and that's what we want to do.